Welcome back to movementprofessional.com. So I just want to use the models here to do a quick depiction of the relationships between the rib cage, thoracic spine, scapula, and shoulder when we're thinking about shoulder external rotation, and also when we're thinking about shoulder internal rotation. So we'll start on the back side here. When we look at the back of the skeleton, we can see the area where the thoracic spine is, we can see the rib cage, and then we can see the scapulas. They're all sort of in contact with each other, and they have really important relationships. Now, the scapula is part of the shoulder complex, right? So it's the socket, basically, is on the outside of the shoulder blade there, and then the humerus makes contact or articulates with that scapula. So everything here has really important, intricate relationships that we have to understand. Now, on the opposite side of the thoracic spine, we have the lungs. So when we are breathing, we have to think about every time we inhale, the intention is to get our lungs to move forward, backward, side to side. They should expand in all directions. So with that expansion, what we should get is this area moving back in this direction, and then on the front side, the sternum should move forward in this direction. All right, that doesn't always happen, but that would be ideal. So when that does happen, we should be able to get more motion in many areas, right? All the ribs should be able to open up more, and then we should get this idea of the scapulas moving away from each other. All right, so as they move away from each other, and then this area basically moves back and gets bigger, that should promote shoulder external rotation. Now, the way that works is that if we think about shoulder external rotation, we can use this model here. If I want to rotate this humerus backward into external rotation, I have to have my scapula fixed, right? So it stays fixed. Now, if we think about this in the other direction where the humerus is fixed, how would I create that same external rotation moment? Or if you think about where the muscles of the external rotators are, they're on the back here of the scapula attaching to the back of the humerus. So if I keep my humerus fixed, and I would actually want to be moving my shoulder blade, the border of my shoulder blade, more away from the center line to get it closer to the back of this humerus, or to think about bringing the muscle attachments closer together, that would promote more external rotation. So thinking about this from the center out, anytime this area here gets bigger and moves backwards, and these scapulas move away from each other, that should be more external rotation. And that's important to think about, because oftentimes when we think about external rotation, we're going back in this direction. So we think about, well, how can I just get my hand back? And oftentimes that'll just squeeze the shoulder blades together, which is actually not really creating external rotation, although it's moving the hand back, but it's creating this orientation of just pushing the chest forward, but compressing things back here. So we just get this kind of orientation issue where the hand is getting more back, getting behind us more, but we haven't really moved from the shoulder. We've just kind of tilted our thorax. So that's important to understand, because if we're doing any interventions where we really want to free up some shoulder motion, we really got to get the breath first. So inhalation into the backside here, shoulder blades separating away from each other should promote external rotation. On the other side here, when we think about internal rotation, we have to think about the lungs kind of pushing forward or moving the sternum forward. All right, because we have all of this musculature on the front, the pecs, pec minor, that wants to pull the shoulder forward. So if we get into this internal rotation and this is all we got and we want to go a little bit more, what happens is we start to compress through here, or we just start to collapse. So any type of improved internal rotation has to keep this area open. So when I inhale, I need to be able to expand into the front here and into the back, because if I don't expand into the back and I just expand into the front, then again, it's just me just tilting. I'm not actually getting this full expansion. So I want to be able to first get into the back, but then also get into the front. And then that front motion will correspond with more internal rotation. Because again, if I don't get this expansion here, any of this motion forward is just going to be, it'll look like I'm getting my hand where I want it to go, whether it be behind the back or if I'm kind of following through internal rotation, but it won't be true internal rotation because I'm collapsing here and I'm just bringing my scapula is going to wing on the backside, and I'm going to collapse into the front thoracic area, or the front rib cage area. So hopefully that makes sense. So when we are doing any type of intervention where we're trying to get rotation, if we breathe into the front chest, we're going to be promoting internal rotation. If we breathe into the back of the space between the shoulder blade and the spine, we'll be promoting internal rotation or external rotation. Hopefully that makes sense. If not, please ask a question. Happy to answer it. I'll see you next time.